Hi, welcome to Air Health, and tonight we will start our Improve Your Sleep um, webinar. So, welcome if you're viewing from Facebook or if you're viewing from the webinar software, welcome. I'm just going to see if I can share my screen quickly. If not, that's okay. Just follow along with the webinar. So, tonight we're talking about improving your sleep, and I'll first talk about what is considered a good night's sleep. So you fall asleep quite quickly. You do not wake. You do not fully wake up at all during your sleep. You don't wake up too early. You feel refreshed in the morning. Um, if you're regularly having difficulty falling asleep or sleeping through the night, it's not normal at any age for healthy people who obviously aren't newborn babies. So, good sleep is you can fall asleep when you want to. At night, you're not waking up at night, you're not waking up too early, and you feel refreshed. You're able to function in your best life. So, how much sleep do I need? It really varies based off of your age. So, for example, newborns 0 to 3 sleep for 14 to 17 hours a night. Infants 4 to 11 months will sleep from 12 to 15 hours a night. Toddlers, we find healthy sleep is anywhere, so that's ages 1 to 2, from 11 to 14 hours a night. Preschool children, this is ages 3 to 5, tend to need to sleep 10 to 13 hours a night. School-aged kids, we're finding, so that's 6 to 13 years. They also need more sleep, 9 to 11 hours. Teenagers, it tends to be 8 to 10 hours of sleep. Young adults, so that's 18 to 25-year-old age range, as well as adults 26 to 64 years of age, can function well on anywhere from 7 to 9 hours of sleep. And then we find that with the aging process, after the age of 65, people tend to need a little bit less sleep, and the experts have found that's from 7 to 8 hours a night of sleep. So, next slide, if you're following along. Again, I don't think I've been able to share my screen with those who are joining us from Facebook, those who are joining us from the live webinar option, which you're welcome to still join us. We'll be able to see the slides, and I can make them available later. So, why do we care so much about sleep? Well, you need to get good quality sleep so that you can feel like your best self. We know that healthy sleep patterns improve learning, memory, creativity, which I think is fabulous, mood, the immune system, and it makes it easier to maintain a healthy diet, which is another great benefit. What happens when you don't get enough sleep? So, when we think about this, we think of what happens in the short term and we think about what happens if you have chronic poor sleep. So, first, I'll go through short term. Short term, if you don't get enough sleep, you may notice lack of alertness. Even missing as little as an hour and a half of needed sleep can impact how you feel. You may notice excessive daytime sleepiness. It can make you feel very sleepy, tired, drowsy during the day. Some people notice impaired memory. So, lack of sleep affects your ability to think, remember, and process information. Relationship stress, it can make you feel moody, and can become more likely to have conflict with others. When you don't get enough sleep, it can impact your quality of life. You may become less likely to participate in normal daily activities such as exercise because you're just too tired. There's also a substantial body of research that shows that there's a greater likelihood for car accidents, and this doesn't come as a surprise. If you're tired, you may be more likely to be drowsy, and drowsiness accounts for thousands of crashes, injuries, and fatalities on the highway. or the motorway, as we like to say in Australia. In terms of the impact of chronic sleep problems, chronic sleep deprivation, there's a number of chronic diseases that your risk increases for. So this includes having high blood pressure, having diabetes, having a heart attack, heart failure, or stroke. You're more likely, if you don't sleep well chronically, to have obesity, mental health conditions such as depression. It also can impact your immune system, and it can lower your sex drive. Next, I'd like to discuss the stages of sleep. So, the first stage is the non REM sleep. So, it's stage one. It's that period when you first lie down and you're transitioning between wakefulness and sleep. It lasts from 5 to 10 minutes. The next stage, we notice the body temperature starts to drop, the heart rate begins to slow, the brain begins to produce something called sleep spindles. This stage lasts about 20 minutes. So the first stage lasts the first 5 to 10 minutes of sleep, and then you start to notice your body slowing. It's kind of becoming cooler. That takes you to about 30 minutes into sleep. And then you get to stage three of the sleep cycle. And this is where the muscles start to really relax, blood pressure and breathing rate drops. And this is when your deepest sleep occurs. And then the fourth stage of sleep, which we call the REM sleep, which is very important, you actually become more active. So the brain becomes more active, the body becomes more relaxed and immobilized, but you dream, your eyes will move rapidly. This is the stage of sleep that is very important to be for being well rested. It's when the body really works to sort of rejuvenate itself actively. So you feel alert and well rested the next day. And it's an important stage of sleep because a lot of substances and things such as alcohol interfere with it. And if you don't have good REM sleep, you're not going to feel well rested in the morning. And that's part of why we um, talk about sleep. So there are a number of sleep disorders. This is the next thing I'm going to talk about that interfere with that sleep cycle and lead to poor sleep. In fact, there's over 70 sleep disorders, which is a lot. I'm just going to go through some of the most common. So the first one is an insomnia disorder. Um, that's when you have trouble falling or staying asleep. I'll talk a bit more about this because it's the most common sleep disorder. The next is narcolepsy, is an example of a sleep disorder. This is when people suddenly fall asleep during the day, even if they've had a good night's sleep before. People may talk about having sleep attacks, which last a few seconds or up to 30 minutes. This is something that if you've noticed this, you need to talk to a healthcare provider for diagnosis and medicine. Then there's things like restless leg syndrome. This is when you experience an unpleasant sensation in your legs, such as prickling or tingling. You may have this urge to move your legs to get relief. And that is something that can interfere with sleep, and there are medications that we prescribe to help treat that. Sleep apnea is another condition that people can experience that interrupts sleep. You may find that you wake up breathing um, while you're sleeping, gasping for air. Um, and there are sleep studies that can be done to assess and diagnose this condition. And sometimes weight loss can help. You may need a special device to help sleep called a CPAP machine. Um, if you do, in fact, have sleep apnea. So if you experience waking in the middle of the night, because you stop breathing, sleep apnea is one of the things that we would look at. Other things, heart failure, for example, is another thing we would consider looking at. So another sleep disorder is snoring. People who snore regularly, that can disturb sleep. It can also disturb the sleep of their partner in the bed. Snoring can lead to tiredness during the day, and there are treatments for snoring. And then, obviously, there can be other underlying causes for snoring. For example, I can remember my sister complaining when I was a child that I snored a lot, and I had giant tonsils that ended up needing to be taken out. And then, after my tonsils were removed, I didn't snore quite as much. The final thing to mention here is mental illness. So there's a number of different mental illnesses that can result in poor sleep, such as having a bipolar disorder, having a manic episode. That's very characteristic of needing less sleep. Depression. Sometimes when people have low mood, they can sleep way too much, or they can sleep just a little. So mental illness is another thing that we look at, and we always ask people that are having a rough time how they're sleeping, how they're eating. Because insomnia is the most common of the sleep disorders, I wanted to just speak to it specifically tonight. So, insomnia is a disorder that's characterized by persistent difficulty with sleep onset, sleep maintenance, consolidation, or quality. People who have insomnia struggle with sleep despite adequate opportunities for sleep. And they also experience excessive daytime sleepiness and other dysfunctions when they are awake. The research shows that at any point in time, there's an estimated 10 to 30% of adults that are living with insomnia, and many of which have undiagnosed insomnia. So, just a little bit more on the diagnosis of insomnia. You need to have this difficulty initiating and maintaining sleep or waking up early um, for at least 3 months, despite adequately trying to sleep. And additionally, in the diagnostic criteria for insomnia, you need to have one or more of the following daytime symptoms. So you're not able to fall asleep at night, and during the day you may notice. So it's just one of the things. You're tired. You have impaired memory, concentration, or attention. You may note negative impacts on your social, family, occupational, or academic performance. You may notice irritability or disturbed mood. Excessive daytime sleepiness as well is it's similar to fatigue but slightly different. Some people notice a sort of paradoxical effect, so they may experience hyperactivity, impulsivity, aggression, or other behavioral problems because they're so sleep deprived. There's also an increased risk for errors and accidents. We talked about car accidents prior, and then just a general lack of motivation or energy to do things. So, treatments for insomnia. There's two main objectives for treating insomnia. One is to improve sleep quality and duration, and the other is to reduce associated daytime impairments. And the treatments for insomnia are multimodal, as in we use a number of different things to try to treat it. The most important of which are improving sleep hygiene, as well as something called cognitive behavioral therapy for insomnia, which I'll talk a bit more about. And if the above two are not very effective, then we may recommend one of the forms of medication for sleep short term. So moving on to the next slide, it's loading. So I'm going to talk a bit more now about cognitive behavioral therapy for insomnia. And it includes also working through good sleep hygiene, making sure you have an appropriate bedroom environment, avoiding screen-based devices before bed, avoiding things like coffee and alcohol consumption. And then, and it's a psychologist that does cognitive behavioral therapy for insomnia. So they may talk a bit about what they call stimulus control. So basically, teaching your body to associate your bed only with sleep. And how we do that is we limit the bedroom only to sleep. So you don't sit and watch TV and read books in your bed. Your bed is just for sleep. And if you can't sleep after 20 minutes of lying there, you get up and you leave the bedroom. And then when you're really tired, you return, and your body learns to associate the bed with a place of sleep, a place of relaxation, and a time to sort of shut down. And it can help you train your body to know that it's time to shut down and start going through those sleep stages. Um, then another sort of technique they'll talk about is sleep restriction. So restricting the times you sleep, not napping, not if you do nap, not napping for more than 20 minutes. Um, and techniques to increase the amount of time you're able to actually sleep in the bed. There's other techniques that they can use, like biofeedback, which you help to relax your body physically. Um, and then they do some, so it's a talk therapy as well. So they will talk about restructuring undesired thinking patterns or anxieties that you may have around sleep, because people who are so tired and they're struggling to sleep may start associating the process of going to bed and going to sleep as a very anxious and stressful time, because they want to sleep desperately but they can't. And so um, working through some of the negative ideas or beliefs you have about sleep in your body is also an important part of cognitive behavioral therapy for sleep. And then they work on that over time until things improve. So next, so that's cognitive behavioral therapy for sleep. I should say that if that is something that interests you, um, most psychologists offer that, and you can access it either privately or with a GP mental health care plan to a psychologist. So if that's something you're interested in, I'm happy to assist or see your regular GP about that. So, what affects sleep quality? I've sort of hinted at it, and I wanted to just get a bit more into the nitty gritty um, to say that there are chemical signals in the brain that influence our sleep and wake cycles. So, anything that shifts the balance of these neurotransmitters can make us feel drowsier and more awake. And that's part of why we take a very broad based and holistic approach to sleep. And that's why there are specific guidelines and advice on avoiding certain types of medications or substances, because it has to do with the chemical signals in the brain and interfering with that, and not being able to get into the restful periods of sleep. So, alcohol I'd mentioned may help people into a light sleep, but it actually reduces deeper stages of sleep, and really interferes with REM sleep and leads to a more disrupted sleep cycle. Caffeine and things like pseudoephedrine. Pseudoephedrine is a main ingredient in cold medicine that you can take. It that can stimulate the brain and cause insomnia. So watch out for drinks that have too much caffeine, such as coffee, or drugs like diet pills and those nasal decongestants that contain pseudoephedrine. Obviously, energy drinks, and the recommendation um, I make to people is try to limit coffee intake to 200 milligrams or less. That is 2 cups of coffee a day, or a cup of coffee and a soft drink, or a cup of coffee and a tea. Um, that's also the guideline for pregnant women who are trying to conceive. So, medications such as antidepressants can also lessen REM sleep. People who smoke heavily often have light sleep and less REM sleep, and may wake up a few hours after they fall asleep because they're experiencing nicotine withdrawal. So, if you are smoking and you're struggling with sleep, that is cutting down, and ceasing is would be something to seriously consider. We also, I think I've just gone a slide ahead. So the final point on this slide is about temperature. very hot or cold temperatures can disrupt REM sleep. Um, we're less able to regulate our body temperature during REM sleep, and so that's why temperature extremes tend to disrupt it. We do find that being in a slightly cooler room is the best uh, for sleep. So I'm just going to talk now. It's sort of the final thing I'll go through, and it is good sleep hygiene practices because I have mentioned a number of them as we've gone through the slides, but I just wanted to consolidate what we've talked about because having good sleep hygiene or good sleep practices is very important. And there's things that you need to focus on doing, and then there's things that you need to focus on not doing. So the things that we focus on doing include having a good sleep schedule. That is going to sleep and waking up around the same time every day, even on weekends and vacations. And the reason is just because we've got a natural internal clock. It's called our circadian rhythm. That's important for having the best sort of circadian rhythm to help with your sleep wake cycles. Um, Clearing your mind before bed is really good, especially if you are prone to anxiety or having anxious, worrying thoughts about what's going on in your life. Um, you can do things like mindfulness meditation, light exercise, yoga. Yin yoga is great. You can make a to-do list early in the evening. Um, you can journal, play music, do art, whatever you find helps you relax. Now, creating a good sleep environment is quite important as well. Make sure your bed and your pillows are comfortable. Turn down the lights, avoid loud sounds, and keep the room at a comfortable, slightly cooler temperature. Exercising every day is a must. Staying active, um, but trying to avoid exercise, especially really, really vigorous exercise in the hours right before bed, is important. If you're busy, come up with techniques to help you exercise. I know for me, setting up a home gym has been quite important. Getting a Pilates reformer, I love Pilates, is something that's been important for me. Relax before bed is another thing you should focus on doing, whether it's taking a warm bath, reading, or doing another relaxing activity. If you have been struggling with sleep for quite a while, 3 months or more, um, and you're feeling drowsy during the day, it's very important to have a visit with your general practitioner to just make sure that you get a complete health assessment so we know that there isn't one of these 70 sleep disorders that they need to also be taking into consideration and treating things like what we mentioned before. But there's many other conditions, heart failure, problems with the thyroid, problems with diabetes. For example, with undiagnosed diabetes, you may find that you're having to get up to urinate a lot. So there's many things that can interfere with sleep. So make sure you've done your yearly health check. Now I'm going to talk about the things to avoid. So, what should you not be doing to help with your sleep? We talked about it, avoiding caffeine or reducing caffeine intake, nicotine and alcohol, and not consuming caffeine, nicotine, or alcohol late in the day because these substances we know interfere with your ability to fall and stay asleep. Don't lie in bed awake. It's better to get up after 20 minutes and do a soothing activity like reading out of bed until you feel tired. And if you're reading, read a novel, don't read a screen because we know that the light source that comes from screens like iPads, computers, interferes with REM sleep. Napping during the day is okay, but don't nap for more than 20 minutes. And try to avoid naps after 3 p.m. That will throw off your sleep cycle or circadian rhythm. Don't think negative thoughts. So try to avoid, which is easier said than done, a negative mindset when going to bed, such as, I don't get enough sleep now. I won't get through my day tomorrow. That's not going to help with sleep. If you're struggling with having negative thoughts and a negative attitude about your poor sleep, talk to a psychologist. Put your hand up for cognitive behavioral therapy for insomnia. It's very, very effective. I just mentioned it before about the screens. Don't use electronics right before bed. This can't be stressed more. I know that I'm very guilty of it. I'm very guilty of getting into bed and just sitting with my iPhone on and scrolling through emails, scrolling through social media. Electronics, such as your phone or tablet, can interfere with your body's production of melatonin. That's a natural substance in the body that helps regulate your sleep-wake cycles. And this hormone, it gets released before bed to help you feel tired. And if you're on screens, it actually prohibits your body from releasing melatonin. And so that's why you hear people harp on about avoid screens. That's why. And we can actually give melatonin as you can take it as a treatment for insomnia. So that sort of segues into this final section of what I'm going to talk about, and that is medications for poor sleep. And medications for insomnia, they fall into several categories, and they tend to not be the first thing that we try. We always recommend sleep hygiene and cognitive behavioral therapy for sleep. If those things aren't working, or your sleep's just really out of whack, we will look at medication for a short period of time to help you sort of reset your sleep cycles as an adjunct to lifestyle changes and cognitive behavioral therapy. So, what sort of medications do we prescribe? One class are the benzodiazepines. These are things like diazepam and temazepam. They work to relax you and help you fall asleep. They are prescribed usually for only a few days at a time. They can be highly addictive. Your body, if you take them for more than a few days in a row, gets used to them, and you need higher and higher doses to feel the same amount of effect. And some people are more prone to becoming addicted to them. And so that's why they're regulated, they're heavily regulated by the government. If they're prescribed to you by your doctor, particularly in South Australia, there is something called script check. So anytime it's prescribed to you, it goes into this database, and any doctor and pharmacist can see whether this has been prescribed and dispensed and how many times, because it's that heavily regulated. Because unfortunately, some people struggle with addiction for it. The next medication is melatonin. So you can take natural melatonin as a tablet to help your body at night feel more sleepy. There's an evidence base for its use for up to 6 weeks. It is in small doses. So I believe it's a 1 milligram tablet. You can buy without a prescription from places like iHerb on the net, or you can get a 2 or a 5 milligram tablet prescribed by your GP or specialist. Melatonin is something that is used in children as well. There's an orexin receptor antagonist that is used more commonly in America. I've occasionally seen it prescribed here. There are also things like antidepressants and antipsychotics that are prescribed for sleep at low doses that are sort of off label. They're also just prescribed in general if you happen to have depression and you suffer from poor sleep. Something like mirtazapine may be an antidepressant that's prescribed for you, because it can both help with sleep and help improve your mood and treat your depression. Then there's the antipsychotic quetiapine, or Seroquel is another example of a medication that can be used to help with sleep. Another over-the-counter option would be first-generation antihistamines. So these are things like Phenergan. They're used to treat itch and allergy, and hay fever. But the initial ones that were made are very sedating. So some people find that they take that for sleep. The last two are more naturopathic substances, valerian and kava. However, there's been limited research that proves that they are effective in helping you sleep, and there are some side effects to them. But that is also something that would be available in the um, vitamin herbal section of a chemist. So this ends the webinar for tonight. If you have any questions about sleep, feel free to message through to either via Facebook or to the email. If you are interested in assessing your sleep quality, we do have in our members portal, there is a survey that you can take that will go through your sleep quality. And if you're quite concerned about your sleep, one of the things that we offer is assistance with sleep through Air Health. And you can take a sleep quality assessment scale, and then we can review it and go through strategies to help improve your sleep, as well as rule out any sort of conditions that may be interfering with sleep. So that ends the session for tonight, and I hope you guys have a wonderful night.